अस्सलाम वालेकुम वरहमतुल्लाहि वबरकातुहू रब्बि इश्रह ली सदरी व यस्सिर ली amri wahlul uqdatan min lisani yafqahu qawli. Dear sisters, I'm Dr. Tehseen Malik, an Ayurvedic doctor with expertise in women wellness, hormonal health, PCOS, and natural conception issues. I basically help sisters conceive naturally who are suffering from hormonal issues and other issues. Basically my project right now is called PCOS to pregnancy, but today's topic is a bit different. It is related to teenage, okay, and it's the topic we'll be discussing today is called teenage menstrual issues. Now this is a sequel of the episode that Sister Alia did earlier regarding talking to your daughter about menstrual issues, and sorry, I offered her that I want to do a sequel because this topic is sorry, this topic is one of the very basic topic that I want to touch on. It's considered a taboo in our society to talk about menstrual issues to our daughter or discuss their issues, outwardly in the society regarding menstruation. Hey, Assalamu alaikum, Sister Alia. Can you hear me and see me clearly? This time I'm not gonna send you invitation. So yeah. So basically we're talking about teenage menstrual issues. Now sister, what is teenage? As per the medical dictionary, teenage starts from age 13 to the age of 19. But here when we are talking about menstruation, because of our recent diet, lifestyle adaptations, usually our daughters are getting menstruation by the age of 10 years or and more. So basically now that I'm discussing about teenage, we are going to start from the age of 10 years to the more, and that's when these days our daughters are getting menstruations. Now it is very important, like Sister Alia said, to discuss with them, to pass on the information and make them aware of the situation that they are going to handle in near future. Because if we don't talk to them, somebody else is going to talk to them, and a mother will have the best of interest for her daughter rather than somebody else. The information passed on to them may be right, may not be right, and they might end up getting confused or even getting upset or depressed about the situation. So it is very important that a mother is well informed, well aware, and she passes on the information to her daughter with hikmah, in a most possible in a most soothing way, so that your daughter doesn't get overwhelmed with this with this upcoming situation. So once the daughter is informed, half of the job is done. Now the first problem or the first health problem that arises with the beginning of menstruation is as to the regularity, okay, and a day or two before I was talking to someone saying that I'm going to do this news feed, I'm going to do this live on a teenage menstruation, because these days girls, they are getting too much irregular menstruation, and they said, oh, having irregular menstruation in the beginning is okay, right, for a couple of years. Now it's not okay to have irregular or disturbed menstruation for a couple of years. No, yeah, for the first year when your daughter starts menstruation, they might have irregularity in the periods for a couple of months, but that should settle down within 1 year. And their menstruation is their cycle is rhythmic or not should also be very much you should be very much aware that that cycle they're having them monthly. Are they having any any period pain associated to it? Are they having any discomfort, cramps? Also, it is very important that you make them aware of personal hygiene, because when you make them aware of personal hygiene, it is first step that they will not get too many infections, especially in that private area. So one thing I noticed during my practice is that girls are not made much aware about personal hygiene from the beginning, and later on they are bought with infections or some minor problems. So it is very important that you talk to her about her hygiene, about hydration, because that time we lose a lot of fluid from our body in form of blood. Okay, although it's like the bad blood that is coming out, but you lose a lot of fluid from the body. So it is very important that you talk to them about hydration. Now the next thing I want to discuss with mothers is that when they are in the teenage, they don't have much information about the biology of their body. They are always wondering what's happening to my body, why are my breasts growing, and how do I cover them, and they become very conscious about it. So make sure that you give them a soothing word, you give them a helping hand, lay down your ear, because a mother should be the best friend. If they resort to somebody else for this kind of help, it is very much possible that they might get into situations where they are misled or things like that. So please, mothers, be aware and make sure that you put the information to your daughter in a very in the most possible easy way. Tell them that this is so natural, having breast growing. Start them with the bras that you get, like the teenage sports one, or the basic ones, so that they know how to handle the situation. Other than that, we talked is about the hygiene used of pads or tampons, whatever you want to talk to them. But make sure that these days there are lots of chemicals and things that are associated with this product. So make sure you stick to the natural pads or products that are possible, keeping that area clean, using a hygiene wash, because if the pH of that area is altered, that means the infection, the private area becomes prone to more infections. So make sure that you talk to them about the hygiene wash that is available in the market, how they should be using it, cleaning the hair from that part. So these are little things that I feel mothers should inform the daughters before they start, or even when they start the menstruation. Now coming to the other health problems that I'm seeing these days, I deal with lots of patients who have PCOS, polycystic ovarian syndrome, and they come in young age. They have problems conceiving, they have problems like excessive body hair, acne, abnormal weight gain. These are the problems that they come with. to me. And I always see, when I take the history, I take a long history, I see that the roots are basically in their teenage, when they started menstruation. They had problems with their menstruation, they had issues, but those issues were not addressed at that time. And you can see, when there is a problem that's a long lasting problem in our body, that will develop into complications. And one of the worst complication of this hormonal health issues and irregular menstruation is not able to conceive. There are lots of other issues like related to that. I'm not trying to scare any mother, but I'm trying to say that when these issues are addressed at a very earlier stage and they are suspended at the teen age, then it becomes very easy, alhamdulillah, for them in the future to go ahead and have babies. So this is very much important. Recently I was counseling a friend's daughter on menstrual issues, and she was telling me, she's a young girl who started with her menstruation on regular basis, and suddenly they became much irregular. When she was taken to a gynae, the gynae said that she has PCOS, and then I said to the sister, inshallah this should be fine. I was talking to her about this, and this little one is telling me, ma'am, I don't want any more I don't want babies anyways. So I said, no, you don't have menstruation because you have to have babies. You have menstruation because this is a part of your biology. And then I explained her the whole biology, how things happen in our body, and if this biological balance is lost, that means there are other issues related to your heart, to your bones, to many other body parts, to your brain, that can take place, and that can be very serious also. So it is very important to explain to your daughters about the biology, how things are going to happen. Now coming to the topic of hormonal issues. Now, irregular menstruation is basically related to hormonal health. Why? Because menstruation is basically triggered by the cycle of hormones. The level of hormones like estrogen and progesterone in our body, its balance, they actually decide as to we should be having periods or not having periods. When there is an imbalance, then there is an irregularity in the periods. So it is very important that this little hormones, this tiny chemicals are fed well and are taken care of, so that your body's balance is not lost. Now, why do this imbalance occur? Mothers, this imbalance occur, first thing, it can be genetic, because we Asian women are more prone to this kind of genetic changes. But nowadays it's as much common in European world, it's as much common in other societies. And the other very important factor related to it is our diet and our lifestyle changes. Alhamdulillah, the life has become more easy, more luxurious. So the diet that we take today has also become more elaborate. We can have like whatever food we wish. It's easily available and it's easily affordable. Use of chicken these days is one of the major root factors that leads to hormonal imbalance, because chicken is very widely and it's used at in great quantities. So to produce this great quantity, there is an imbalance created in the nature. The chicken are loaded with hormones, and you eat that chicken. So basically you are taking artificially ingested hormones to our kids, like from their teenage we are doing that, from their childhood we are doing that, and that actually manifests in their teenage in form of health issues related to menstruation. The other thing that is very much important is that sugar, use of refined sugar or salt or even refined flour, that all contributes to an increased level of insulin. And insulin is a hormone that regulates your body sugar, but an increased level of when there is an increased level of sugar, there is an insulin resistance that is developed in our body, and this resistance also leads to this hormonal issues. Now this resistance at a very early age, in the teenage, doesn't show up much. It just shows up in form of your daughter gaining weight, okay, maybe on her abdominal area or on her buttocks area. But then later on, this kind of insulin resistance may manifest into early diabetes or other health issues. So it is very important that we take care of what kind of diet we are feeding our children. Even if they are teenage, it's not too late to make a change. It is here in UAE where we live, or in back India or Pakistan, there's hormone free farm fed chicken that is available widely. So make sure that you choose healthy options for yourself, for your daughters, and for everybody else in the family. Replace your white stuff, like your white sugar, with honey is the best, or coconut sugar you can replace it with. There are certain herbs that are widely available, and I would rather say that if your daughter is going through problems, irregular menstruation, even after the first year of since her menstruation cycle is started, try seeing a doctor who supports diet and lifestyle changes, rather than taking her to doctors who actually put them on oral contraceptives, and when they have pain they put them on painkillers. So basically deal with the root cause of these problems, and inshallah the problems in the future can be avoided. The first step to dealing with this problem is making yourself aware basically, and then making them aware of the condition that they are going through. Creating awareness on your diet, on your lifestyle, because our lifestyle also has become very up and down due to their studying routine, due to their their school routine. So make sure that their biological cycle is maintained in terms of diet timings and sleep timings and stuff, and their diet, plus getting a counseling and a consultation from a doctor, especially somebody who's practicing alternative medicine or herbal medicine, because we have excellent remedies. Even the best medical institution regards that hormonal health is best treated by diet, lifestyle changes, and alternative therapies, rather than just putting them on oral contraceptives. So sisters, I want to know if there are any more questions that you would like to know about teenage menstrual issues. There are lots of things that we can talk. I basically tried to touch the general points that I see, and I see lots of cases where, as I told earlier, the cases that I see in late 20s or late 30s, when I actually go back and take their history, the root cause was lying in their teenage. Had they been treated and had they been made well aware of their condition in the teenage, then they might not be facing this grievous problem in after 10 years or 20 years of their like growing up, or they might not be facing problems related to infertility or stuff like that. So our daughter's future is very much, I mean, subhanallah, it's in the hand of Allah, but it's very much important that we take the means and we do efforts, and then we make dua that inshallah may Allah grant our children a healthy future, and may Allah keep them safe from different type of complications and diseases that have just erupted out of the blue in today's day and time due to our corrupted lifestyle and our diet. Sometimes we don't even know that the diet and lifestyle that we are living is we regard it as pretty much healthy, but the food that we are ingesting is not the food that how it used to be, and it doesn't give you a proper impact on your body. So make sure that you're very well informed. You make your choices right for yourself and your daughter. Sometimes I feel I have patients who say that my daughter doesn't take doctor, you advise me to take this like apple cider vinegar or things like that for the hormonal, but she doesn't take it. So then I say, okay, just bring her or let me talk to her over the phone. You have to explain her the complications that might occur if she is not cooperating with this part. Just tell her it's a question of 1 minute bitterness, or 1 minute of taste, the taste problem will persist for 1 minute or 2 minutes, but then if you don't take care of it, you might face a bigger problem for your life. And usually I feel, mashallah, our daughters are much they are very very cooperative, mashallah, and once they understand the importance, they do try to incorporate all the recommendations that we give. So any questions? Alia, are you still able to see me? Or it's showing that 2 people are with me together live. Alia, are you able to see me, or did I just do the okay, any questions coming from your side? Right now I don't see anything. It's showing 1 person. Alia, just comment if it's you there. Okay, so what I'll do is, ladies, I'll leave you here with this information and lots of du'as that may Allah make it easy for the parents, because it is very difficult to see our kids suffering from the current lifestyle challenges. So I would say that may Allah make it easy for us and our children. May Allah give them a bright future, a healthy future, and may Allah make them may Allah keep them safe from all this kind of health issues, give them a healthy life and a healthy future ahead. Any questions you can post below in the comments on my video, and inshallah as and when I'll try to check and answer them. Anything, you can contact me in person on facebook.com/Dr. Tehseen Malik. You can message me if you have concerns with your child's health, and inshallah I'll be happy to help. Take care, sister. Assalamu alaikum wa rahmatullahi wa barakatuhu, and thank you for being there.